Okay, good morning, everyone. Welcome to our virtual Walk with the Future Doc. It's nice to see some new faces on here too. I'm a third-year medical student at WVU, and I was just going to go over like what to expect for about the next hour as we walk together virtually. So Dr. Nield is going to be speaking about the topic of childhood vaccinations. And then as we walk together, she will be able to answer any questions that anyone has. Everyone should have received a little like pop-up notification just to consent to the recording of the walk. And only the audio portion is going to be made available publicly on our YouTube channel, which is WVU Walk with the Future Doc. And if you do not wish to be recorded, we just ask that you leave the meeting and then watch the recording once it's posted on our YouTube channel. So thank you everyone for joining us. I'd like to introduce everyone to Dr. Nield, who's a pediatrician with WVU Medicine, and she's going to talk to us about childhood vaccinations today. So I will pass it over to you, Dr. Nield.
Thank you. Good morning, everyone. Happy to join today, even though it's quite brisk out, but it's good for us. So yeah, I've been asked to talk about childhood vaccines, and I'll end with just talking about the COVID vaccine of what I know about it, but that's changing, seems hourly. So I always will have to have a disclosure when talking about vaccines that I've never been paid by any pharmaceutical company that manufactures vaccines to speak on the behalf of vaccines. And I'm a salaried pediatrician at WVU, which means I can give 0 vaccines and still get the same pay if I give 100 vaccines in one day. So I don't have any conflicts of interest with talking about vaccines. I do want to also let you know, and if you don't know already, that many private practices no longer give vaccines. They'll rely on the health departments because the cost of storing vaccines and having insurance on those storage facilities and so forth, and the stockpile of vaccines, the amount of money that ends up getting paid to the physicians is less than all of those overhead costs. And so to say that physicians benefit and only want to give vaccines because of financial gain is far from the truth. So I'm a very strong advocate for vaccines because of all the science I've read over 30 plus years. No medical intervention, including vaccines, are without side effects. Some vaccines, in a tiny percentage, can have very serious consequences. No medical intervention, as I said, is completely without risk. But with the amount of science that's been put forth to study vaccines and their development, probably more than any other medical intervention that exists today, the benefits far, far, far outweigh the risks for the general population. So that's why we have vaccines. Many of the diseases that we vaccinate for don't even occur naturally anymore in the United States, like polio. However, they do occur elsewhere in the world. And if this current pandemic didn't make it clear to us, the next case of polio in the US is only a plane ride away for someone that may be in Pakistan or Afghanistan, 2 of the only countries that still have endemic polio. So those types of diseases come in the United States. They're not endemic here, but that does not mean that it could not cause an outbreak like that's occurred with measles, for instance, at Disney World in the last 5 years, Disneyland, excuse me. So that's why we still vaccinate, because the diseases still exist worldwide. And our goal is to wipe off these diseases that we vaccinate against off the face of the earth so that they just don't exist anymore in nature. So the big success story that we always talk about is the smallpox vaccine. which was developed in the 1700s. Edward Jenner, probably remember that from biology class or immunology, or we'll get to that, or we'll hear about it in your peds rotation. That's when the smallpox vaccine came on the scene. If you're not familiar with smallpox, Google it, look at the horrific photos of what it's like, and you can see why we're just so lucky and fortunate that we don't have to worry about that disease anymore. The last natural case of smallpox in the world was in 1977 in Somalia. There was actually a case after that that wasn't from the wild, but it was from an individual who was visiting a lab in Birmingham, England, and it's unknown exactly how the individual got the smallpox, but it's felt that somehow through the vents or somehow contacted it because she was a floor above where the vaccine was being, not the vaccine, excuse me, where the strain of smallpox, not in nature, but in a lab, was still there. And at first they thought she had a bad case of chickenpox, but the mother knew she had chickenpox as a child, and it ended up being figured out that she had smallpox. That was in 1978. But the last natural case in the world was in 1977. Thank goodness, right? I've had the smallpox vaccine. Probably none of the medical students have had the smallpox vaccine. There's more proteins or antigens, or for those of you who are not fully in medicine, the materials that make our bodies produce antibodies or make us immune. There's more of those products in the smallpox vaccine than there are in all of the vaccines we give today. So one of the issues that those who are very vaccine hesitant or anti-vaccine will say that it overwhelms the immune system. Nothing compared to what the smallpox vaccine had in it. And our immune systems are never tested more for how much they can handle than the day of our birth, because we're leaving a sterile environment and coming out, if we're born vaginally, through an opening that's right next door to another opening that is far from being sterile, and getting hit with all different types of bacteria, viruses, and so forth. Fungus, yeast is on our skin too, right when we're born. So that's a testament to when someone has a healthy immune system. An unhealthy immune system is a different story. The students learn about how you vaccinate children with various immune deficiencies, and that's a whole other topic, and each immune deficiency is treated separately because it depends on what part of their immune system isn't functioning and so forth. So in the 1980s, when I was a student, we probably vaccinated for about 5 diseases. And now in 2020, we vaccinate against, does anyone know how many? Routinely in the US. How many diseases do we routinely vaccinate against? Throw out a number, someone.
40.
Okay, good guess. Who was that, Mia? Yes?
Yes.
You want to know what, Mia? I hope we get up to 40. That would be fantastic. But you're in the right direction that it is much more, right? It's 16 different pathogens that we vaccinate for. Now, if you include vaccines that we have for all different types of bacteria or viruses, like if you throw in yellow fever and salmonella and typhi and so forth, we're getting close to 40. But for those that we routinely and that are mandated in the US for school, it's 16. So again, I want to reiterate, no vaccine is perfect, but they've been extensively studied, way more than something like vitamins. Not against vitamins at all, but many individuals have no worries giving their child a chewable vitamin every day, whether it's advised by their physician or not. There's way more science behind the use of vaccines than the use of vitamins in kids. And they're not without their side effects either. But there's always ongoing research to improve. So vaccination begins right at birth. What's the first vaccine we give at birth? What's on? I bet Anna knows. First vaccine we give at birth. It wasn't in existence when you were babies. The vaccine was in existence, but we weren't giving it to babies. It's the hepatitis B vaccine. And the reason that we give hepatitis B vaccine is because when it was originally created, it was meant for those who are at higher risk of getting hepatitis B. You get hepatitis B the way that you get something like HIV, bodily fluids and so forth. And you're thinking, why would a baby have that issue? Well, if a mother carrying the baby is infected with hepatitis B, the baby has a 90% risk of getting that hepatitis B and then going on to be a chronic carrier. And we know that chronic carriers are going to have a higher risk of having liver failure and actually getting cancer from hepatitis. So it was put into effect probably about the time I was a medical student in the 1980s to vaccinate all children, because parents are wonderful about getting their kids vaccinated, not as great as getting themselves vaccinated. So we started off at birth with the hepatitis B, and that's a 3-dose series over time. And then the way it's been studied, the vaccine schedule is at 2, 4, and 6 months. Children get the same vaccine combination. The students will learn during my vaccine lecture during the 3rd year that I came up with a mnemonic. The mnemonic is Dr. HIP, which is DRHHIPP, which stands for the different diseases that we protect against, such as diphtheria, tetanus, pertussis, rotavirus, inactivated polio vaccine, Haemophilus influenza, strep pneumococcal influenza. I think I may have named them all. Then, so that's what you do at 2, 4, and 6 months of age. We don't start live vaccines until a child is a year of age. And measles, mumps, rubella, and varicella, which is chickenpox, is what we start at a year of age. And the students know that we don't start those until then, because the mother has immunity against those and gives those to the baby through the placenta. But then they really don't need the protection yet until about a year. And then hepatitis A is also started at a year. It's not a live vaccine, but that's the way it was studied and approved for. Children in the first year of life absolutely can get hepatitis A, because unlike hepatitis B, which is through bodily fluids, hepatitis A is by putting stuff in your mouth. And as we know, once babies start to crawl or able to reach, they love putting things in their mouth to explore. Maybe eventually it'll get approved for younger kids. It just hasn't been studied or approved that low. And then, so back to when I was a student and a resident, a kid got no more vaccines after their preschool visit. But now, in the last 2 decades, there's been the advent of a pertussis vaccine, whooping cough vaccine that can be given to older individuals. And there's also a vaccine that's been more effective to protect against a terrible case of meningitis caused by Neisseria meningitidis. And so, and there's also been the advent of the human papillomavirus vaccine, which is an infectious cause of cancer, of cervical cancer. So now, instead of telling kids at that 4 to 6 year visit, hey, you don't need vaccines again until you get your driver's license. That's what I used to tell them, because 10 years later, you needed your tetanus booster. Now you have to tell them, oh, you don't get shots until you're 11 to 12. And that, we call that now the adolescent visit, where they get those 3 vaccines. The human papillomavirus vaccine, the meningitis vaccine, Neisseria meningitis vaccine, and the adult or the bigger kid version of the pertussis or whooping cough vaccine, because it was found that kids, that older children and adults, a good percentage of them that had a chronic cough would actually have pertussis or whooping cough. And for them, it was just a nagging cough. But for babies in the first year of life, it can be deadly. And then, beginning at 6 months of age, which is also much different than when I was a student and a resident, is that everyone is recommended to get the influenza vaccine every year. So when I was in training, I knew nothing about the flu vaccine. That was just something you, quote, gave to the elderly, unquote. But studies showed that morbidity and mortality for children, especially in that less than 6 month age range, was higher than it was for the elderly at the other extremes of age. But who are those babies getting flu from? They're not going out to the grocery store. They're not going to school. It's their siblings, their parents, bringing it into the house. So it was enacted again, not that long ago, within my career time, to recommend to vaccinate everyone. And if a kid's less than 8 or 9 and has never received a flu vaccine, it's recommended that they get 2, separated by a month apart. So then that's a nice segue into the COVID-19 vaccine. I don't know how much everyone knows about it. As I said, it seems to change hourly, what I'm reading. So what I tell you right now may not be 100% accurate. It will be changed. But you've probably all heard that it's not just going to be a 1 vaccine and we're done. It's going to be 2 doses. That's similar to a kid who's 8 or 9 who has a naive immune system and hasn't had many flu seasons. So that's why we give them 2 vaccines to really boost them. That's the way this Corona-19 pathogen is for everyone. It's brand new as far as we know. And so therefore we all need 2 vaccines that are going to be separated in time. And I've seen different lengths of time between what the 2 doses are going to be. And there's different pharmaceutical companies working on this. So my thoughts on the COVID-19 vaccine. I want to get it as soon as it's possibly available for myself and my family because of the following. I think individuals are worried that, oh, it was rushed. How do you know it's safe? More than 100,000 doses have been given to the public. Some people get side effects. I've read as high as 5–10%. One could look at it to say, well, that's showing it's doing what it's supposed to do. It's revving up the immune system. The side effects, I guess, technically are not directly due to the vaccine. It's indirectly due to our body reacting with immunity, pumping out chemicals and mediators that say, hey, let's attack this or create something to attack whatever this foreign material is that came into our body. Those parts of inflammation make us feel terrible, right? That's the common cold is the same thing. It's how our body responds. The runny nose is from leaky blood vessels because of the immune system rushing in there and doing things to try and rid the body. So we're going to have side effects. Some of us may feel awful for a day, possibly even longer. The nice thing about it, though, it's a finite amount of material that made us react that way, where if you get the actual virus, don't we all wish that we're going to be the asymptomatic case, right? That's what we're all hoping. We're going to be the person who gets it and is asymptomatic, right? That's everyone's dream. I want to be that person that has no symptoms. Well, there's a good chance all of us could be, right? It's the percent of kids that end up in an ICU from COVID is less than 1%. But what happens if that less than 1% is your own child and you could have had a vaccine that so far has 0% mortality, 100% effective against severe COVID infection, 90 to 95% effective against getting it at all. So yes, we can still get the vaccine, but the chances of us getting a severe case if we're vaccinated, as of now, I'm reading 100% for severe COVID cases. So for me, I would much rather take the risk from the vaccine, have the day of feeling awful, and or however long it'll be, and knowing that it's a finite amount of material that was put into me to trigger a reaction, as opposed to the actual disease, which is a live entity. We still don't know a lot about it. Even individuals that seem to do okay with it, there's reports of this post-inflammatory condition. In children, they call it MISC, like a multi-system illness due to COVID, where they have florid inflammation, like red eyes, big lymph nodes, heart disease from it. And that's a tiny, tiny percentage. But again, there's no risk of that from the injectable vaccine. So for me, I am so anxious to get the vaccine, but so disappointed that I was told that probably for me as an outpatient physician, that I probably won't get it until January, and that inpatient doctors and those who work with COVID patients are going to get it first. And it all depends on what the uptake is. If every single person accepts it, it probably won't be until January. But if there's a lot of refusals, then I'm right there to say, hey, I'll take the one that the person didn't want. But again, that changes daily. And and the people who I ask are working at the state level in Charleston about how it's going to be distributed in West Virginia. And they don't have a crystal ball either. But I guess the fear is that, quote, it's been rushed, unquote, the vaccine. I think of it more is that more time and it's been expedited, where instead of a vaccinologist working 8 hours a day because there's no rush, they're now all working 12, 16 hours per day to move this along. Again, never said it's totally safe. Are there side effects out there that maybe will pop up when millions of us get it? Absolutely a possibility. For me, though, personally, I will still want to take the risk from the vaccine, but I already gave my disclosure at the beginning that I am extremely pro-vaccine, and because of the science behind it. So that's all I had prepared. So does anyone have any questions, comments? And certainly I'd love to hear from the students and doctors on if their thoughts on the COVID vaccine versus risking getting it and so forth. So
Yeah, well, thanks so much, Dr. Nield. So we're going to open it up for questions now. There are two ways you can ask questions. You can either unmute yourself and ask your question directly, and we have both Dr. Nield and Dr. Tria Haggerty on the call here, or you can send your question in the chat. You can send it directly to me, and I'm Mia, or you can send it to everybody, and we'll make sure your question gets asked. So we'll go ahead and open it up for questions.
I actually had a question. Thank you, Dr. Nield, for that talk. I really appreciate it. And just to answer your kind of comment earlier, I would be first in line to get the vaccine also.
Who's speaking?
But,
Let's see.
oh, it's Liz.
Oh, hi, Liz. Yes.
Hi. My question was just what you do whenever you have parents that are vaccine hesitant, and kind of what you do to try to educate them. Any kind of tips that you have
Yes.
in terms of doing that?
Yes, I can send you guys all an article or two that I've written on this topic. So I've looked at the literature extensively about, in order to counsel someone about anything, you have to know their reasons why, right?
Yeah.
So really, you have to figure out why. Why don't they want vaccines? And really listen to what they say. And so what do you think, Liz, is the number one reason that parents are vaccine hesitant? What's the number one reason?
I guess probably that old article about autism.
Sure. So you're right. It's safety, right? They're worried about the safety of vaccines. And human nature is that, and there's some psychological principle, if there's any psychologists or psychology majors on, that humans feel much better if something goes wrong because of an act of omission rather than an act of commission, meaning that if I didn't vaccinate my child and they got flu and died from it, that's easier for me to tolerate as a human than if I gave them something and that thing did something harmful to them. That's harder for us to face as humans. But really, by not doing something is actually doing something by not vaccinating. So there's that natural tendency for humans to feel that way. So safety by far is the number one reason. And so if that is what it is for a parent, years ago, I used to get so bent out of shape if a parent refused vaccines. Now, I find out why, and the vast majority of the time it's going to be safety. It's recommended to do motivational interviewing where you just say something to the parent like, what % chance do you think you would give your child the vaccine? And if they give you any leeway, like say, oh, there's 99% I will not give my child vaccines, you hop on that 1% and say, well, why didn't you say 100%? And they'll probably come up with, well, maybe they are effective, maybe blah, blah. And then you sort of lead them down the path so that they almost are talking themselves into why they should be getting the vaccine. That's what motivational interviewing is. If you haven't already in your careers had a chance to do a workshop on motivational interviewing, please do it because that's a very effective way. It may take multiple sessions. It's recommended by the American Academy of Pediatrics not to dismiss families from your practice if they don't vaccinate. However, some pediatricians would argue that if a family doesn't trust you on that issue that you feel so important about, are there going to be other issues that you're going to, disagree on, and your disagreement and lack of, you feel like it's a lack of trust on your recommendations and so forth. And then physicians are worried about other children in their practice and so forth if they have a family that's not vaccinated. But anyways, find out exactly why. If it's safety, you have a better chance of moving the needle there because you can show them and let them know about cases of kids who got these diseases when they weren't vaccinated. You do have parents sign a form that the American Academy of Pediatrics has that says, I was thoroughly informed that this was recommended and I'm refusing it. You can still get sued as a physician if you did not give a vaccine and the child gets the disease. So even if you have that form, but it would be helpful. Even if it's the parent's the one who refused it, you have to show you did due diligence to explain them the risks and benefits. Other reasons why parents don't want to give vaccines, number 2, 3, and 4, much lower percent of why parents have the safety issue with things like they'll tout religion. Although there's another great article I can share with you by a man who is a PhD that actually works for a vaccine company. However, he looked at religious doctrine and talked with religious leaders from the 5 or 6 largest religions in the world: Catholicism, Islam, and so forth, Jewish, and there was no doctrine from any of those major religions that did not allow for vaccines. But anyone can have any religion, right? And it's not our job to change someone's religion. So if someone truly says it's their religious belief or a philosophical reason, that's going to be very difficult to entice them to get vaccinated. And then some worry that we're all interested in vaccines because of money, or pharmaceutical companies, control us, that type of thing. And, you understand why some people come to that conclusion with some things that happen sometimes with politics and that kind of stuff. So that's hard to argue against too sometimes. And then maybe a lack of appreciation of herd immunity. Like, yes, even though your child may be at low risk to get a bad case of chickenpox, a little Billy who lives next door that is on chemotherapy, chickenpox would probably kill him or make him seriously ill. So appealing to one's altruistic side and just saying it's more of an act of altruism now with how low some of these diseases are in our country. So, but work with the parent, try to avoid doing made up schedules, because again, you've already heard me say about how much science has been put into the vaccine schedule the way it is. I couldn't even begin to think of how to change the schedule. That's pretty bold of me as a single person to try and change a schedule that's come up with years and years and years of study by people way more expertise than I am to come up with my own schedule. Sometimes you have to be creative with families, but in time, you guys will develop, your stance. And I think read anti-vaccine literature, go on websites, read the anti-vaccine websites, and know what the controversies are. And knowing them, you better able to address them. And if you find something that you think is valid, look into why it is or isn't true, or how you could counteract it. So I hope that was helpful, Liz.
Yeah, thank you.
And I don't know if sharing that you yourself have been fully vaccinated and you've had all your children vaccinated and grandkids vaccinated and so forth, I don't know if that helps any, but some families like hearing that anecdotal experience to make it more real, that, the doctor's getting all her kids vaccinated. Maybe that, that's saying something. So.
Linda, on the religious one,
Yes.
I often ask them about if they've had a talk with a religious leader about
That's great.
Because I've had that happen where somebody came in who's Catholic and they had heard the vaccine was made from aborted cells. And I find out that they've never actually asked or talked to their religious leader. They had just seen on websites. Yeah, so I ask them to do that, and I tell them I'm willing to talk to their religious leader too, just so I understand a little bit better why their feeling would be against the church if it's a Catholic situation. So
you're right. That's an excellent point. And I am Catholic myself, and I've had this discussion with my sisters. I have 5 sisters, and one of my sisters is like extremely Like, I mean, like, as far over as you can be against abortion. And so when I told her about, yes, some like the measles, rubella vaccine, for example, it's tissue in there that was taken from an aborted fetus, you know, decades ago, that are still propagated those cells to make the vaccine. She was devastated. She's like, it just shouldn't be like that. And I'm like, but that's the way it is. But if you look at the the U.S. Catholic Bishops Association, it'll say in that doctrine, you can look it up online, that because even the Catholic Church will say, because it's for the greater good, that vaccines are moral. And that, yes, if scientists can come up a way to not have used that, then you should use that product. But since that is not in existence, so if anyone's interested, you could read about that, about use of fetal tissue in vaccines and the Catholic Church's stance on that. But yes, Dr. Haggerty, that is an excellent point, to talk with your physicians, because parents aren't wrong a lot of times. So there's true, like, if not fully true, you know, fully the actual situation. Like, the parent must have read that, like my sister, and was devastated by it. Like, what? You know, but then you explain that the Catholic Church even says that vaccines are moral, even despite the tissue. And also saying that the abortion didn't occur for that reason, to make the vaccine, but it was like good came out of that. So, but I like that, saying talk with your church leaders about it. That's a good idea.
I also bring up that because I've read that through some of the Catholic Church things I've read, is that the other thought is that you're not taking into account the good that has happened from something that they view as so bad. And so by not getting it, you're not actually helping that legacy.
Yeah,
you know.
Yeah, that makes sense too. Yeah. So maybe, quote, adding to the morality. I know that's a whole other topic. But yeah.
The other thing I think about too, and I've had this happen, so that's why it hit me, is if you can get rapport with the patient. This is why I don't like firing patients for vaccine refusal. If it might not be the first visit, might not be the third visit, but then it might be the fourth visit where they've gained trust in you. And so I don't hit them hard all the time, because their beliefs have been so ingrained by these websites and these anti-vaxxers that sometimes I just gently give them some information at each visit. And then once I feel like I have good rapport, I might go a little harder about it. But I've had people switch after they trust me.
Yes. And then, and then if you do fire them, then you never have any influence on them. And it has been found that if they leave your practice, they are probably more likely to seek out someone who, you know, is more in their mind frame of anti-vaccine. So if our ultimate goal is to vaccinate, then we may have lost that family. So
yeah, I feel like it's the opposite of motivational interviewing in a lot of ways, because not only are they going to leave your practice, but they're going to leave your practice with a more deeply held belief that vaccines are bad.
Oh, that's a good point. Like more of a vengeance against it, more ingrained. Yeah, because that's a negativity associated with it. That's an excellent point too. Yes. What's family medicine stance on that, Dr. Haggerty?
No, we do not fire. Yeah, we don't fire because of that. That's been brought up. I mean, I think at any practice it's brought up.
Yes.
But it's never been something that we've entertained.
Yeah, the AAP used to say, you know, definitely do not fire them. Now, though, they're more neutral, saying, you know, weigh the pros and cons and blah, blah, blah. Certainly they prefer we don't fire, but there's like that loophole in there that, you know, the AAP isn't horrified if you were to fire someone, where before it was more like that, like you never fire. Now it's more in the middle, saying that. So
I think we're a little bit protected in our waiting rooms in West Virginia, So I know that a lot of practices will also say that they can't have people in the waiting room exposed, but our schools require the vaccines. So one, I don't feel like we get as many refusals, but the other thing is our waiting rooms probably got a pretty good herd immunity to most vaccine illnesses. So I don't know. I don't think it's a good reason to kick kids out. You know, if you were taking care of a lot of kids with illnesses that they couldn't take the vaccine, they would all be in a waiting room with someone that's in a vaccine. That could be a concern. But there's a lot of concerns for those kids that we have to think about.
Yeah, that's a good point. And I know for us with pediatrics, now that we have our subspecialists in a totally different building across town, that
Yeah,
we have less of a chance of having a high number of children, with
illnesses.
in the oncology clinic sitting next to, the kid getting there for a well visit or whatever. So, well,
Right.
it's been shown that even separating well and sick rooms don't help with disease spread.
Right.
So, which is discouraging, but so.
Dr. Nield, I
But
do
I
have a
don't have
question.
a private. Oh, yeah.
There's a
Go
question
ahead.
in the chat I wanted to ask. But you could finish what you were
Okay.
saying first, because this goes back to the
Oh, I
COVID
was just-
vaccine.
Oh, okay. I was just going to say that I don't have a private practice anymore since I'm only in clinic a day a week now. So I only work in the acute care clinic. So I don't personally now experience many full vaccine refusers. We will get parents who definitely will refuse the flu vaccine or the HPV vaccine, or what else is another one? Those are the two big ones that parents won't want to get. And so we'll work on them at every visit gently, but to get a full vaccine refusal, like I don't want any. Personally, I haven't had that in a while because I haven't had a private practice of patients for years now. So anyway, so what was the COVID question?
Yeah, the COVID question was about the vaccine, and the
Yes.
question was, have there been trials in children on
No,
testing the vaccine?
not
And
that
so,
I
what are
know
your
of.
thoughts on that, or like how can we give a vaccine if it hasn't been tested in
Yeah,
children?
it won't be given to children, I'm sure. I tried to find out the youngest age and I couldn't find it out, but I'm sure it's not younger than 18 right now. So yeah, children, that it won't happen. So so picture yourself as being the parent. Would you allow your kid to go in a vaccine trial? That's vaccine trials in extremes of ages or pregnant women and so forth are much more difficult to do, because just put yourself in that position. Would you volunteer to be a subject or have your child be a subject? That's why it can be difficult. So that's yet to be determined. So and there's it's on both sides, where some feel very strongly we have to push for that because kids are asymptomatic carriers and they're the ones, going to be big vectors or carriers of it, and they're feeling fine, but could hurt grandma, for instance. And then others are like, but they typically have a mild case, so why are we worried about them? And then there's the tiny percent of children that go on to have that multi-system inflammatory disease, which definitely can kill a child, and we don't know why one kid over another gets that, but it's something that has to be monitored for after you get the natural disease. So the answer is there is none yet for children, and I have no idea when that'll happen.
Okay, and then we have a follow-up question in the chat also about the COVID vaccine. The question says, I've heard that there are 3 vaccines that are claimed to have high efficacy. Are there any major differences in the production or delivery between these 3 vaccines? And if so, is there a way to tell which is the most efficient and appropriate?
Yeah, so there are different companies that did things maybe a little bit differently, and I don't have exactly all of the details. I know one of the methods is to use something called messenger RNA, which the students and doctors on the line And anyone who's had biology or cell biology know that that helps manufacture things in our cells, and that messenger RNA, using that as a procedure, is why it's so safe, is because it just revs up our cells to produce antibodies specifically against whatever part of the virus that we're trying to fight against. Another one was using different vectors, called like using another virus that it sort of attaches onto and tricks the body into responding because it knows how to react to that other virus that it's attached to, called adenovirus, which is a common cold virus. And the third way, I think it's a protein conjugate vaccine, and maybe someone can correct me, just like the Haemophilus influenza vaccine and the Neisseria meningitis vaccine, where it uses a product attached to the inactivated virus product that again tricks the body into responding to it. I've read that there's some minor differences in efficacy, but all of them for getting the disease at all, is in the 90s percentile of 90% of it being effective so you don't get it. And then again, near 100% of avoiding getting a severe case of it. I don't think we're going to be in a position to say, well, which one of those vaccines should I get? I think it's whichever one we're going to have offered to us, you take it, because I don't know how it's going to work out with supply of, if it's going to be like the riches of, what's it called, the spoils of riches? What's that phrase? We have so much to choose from. I don't think we're going to have that. I think it's whichever one we're going to receive, you go for it. So I hope that was helpful. And certainly, if anyone has any more up-to-date info than that, please correct me if I said anything wrong.
Yeah, well, thanks so much, Dr. Nield. We're going to wrap things up here. Could you give us 3 takeaway points from your talk today?
Yes. Okay, let's see. So vaccine preventable diseases are very low in the US, but they do still exist in the world. And the next case of something like polio is just a plane ride away. So vaccinate. Number 2, no medical intervention is completely without side effects. Even when we give patients water via an IV, we can overdose them on water, and that could harm them and even kill them. So no vaccine is 100% safe, but it's the best that we have now. And thirdly, I'm getting the COVID vaccine as soon as I possibly can. And I hope you seriously consider getting it too, if you're offered it. Certainly you look at risk and benefit from your viewpoint, but I gave you my personal stance on it.
Awesome. Well, thank you so much, Dr. Nield, for being our speaker today. We really appreciated it. And we had some good conversation, and hoping that we'll get that COVID vaccine very soon. So thanks so much, everyone, for joining us. If you're new, if you wouldn't mind right now, open up the chat button and say who you are and where you're walking from. Well, actually, everybody, if you could do that. Type in the chat who you are and where you're walking from. We're just trying to track how far our program reaches. Yeah, but thanks so much, everyone, for joining us today. I hope that you enjoyed this talk. If you know someone who could benefit from hearing this talk, we're going to be posting this talk, just the audio portion, on our YouTube channel. So when the link becomes available, you're more than welcome to share that with those you think might benefit. So everyone, have a great Saturday, and thanks so much, Dr. Nield, again, for joining us.